Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, global markets reporter at Nasdaq. Healthcare innovation has been at the forefront of the news cycle in light of COVID-19, whether it's the race for therapeutic, telehealth, diagnostics, or technology. Joining me to discuss and review an index that includes the companies driving the way forward is Ben Jones, his product development specialist with Nasdaq Index Research. Ben, it's great to have you with us. Welcome back to Trade Talks.
Hey, thank you. Thank you for having me this week.
All right, Ben, let's talk about the top 10 healthcare innovations.
Yeah, I mean, what a subject, right? I think it impacts everyone today as, you look for the next headline of, have they discovered, have they found a, COVID-19 vaccine? What stage are we on in the trial and is it working? But I think what's interesting about kind of the healthcare space and more importantly, kind of healthcare innovators is how they're not just the innovators that are, coming up with the next vaccine for the next virus. These are the ones that are, coming up with other drugs and other vaccines and other ways to administer health, other devices that are able to, identify, different cancers at different stages. So, it's really an important segment of the marketplace. And there's a couple reasons why. So I want to set the stage before we delve into the index itself. So what's really impacting healthcare and the innovation space? For one, healthcare spending is increasing and increasing at a rapid pace. Back in April, the Center for Medicare and Medicaid Services stated that national healthcare spending in the United States is expected to grow at an average annual rate of 5.4% from 2019 to 2028. That's more than what they expect for the growth of GDP. What's interesting is that they expect to see healthcare spending rise to $4.01 trillion in 2020. I mean, that's a number I can barely comprehend. And also, they see the demand for healthcare services and products and devices is rising as well. There was a piece that was recently published in the Journal of Health and Medical Economics that basically stated that countries will spend 20% of their GDP on healthcare by 2050. And the reasons for that, basically the increasing prevalence of preventable illnesses, think obesity, for example, and the suboptimal use of healthcare. And so because of those two forces, you need innovation. You need companies to come up with new technologies that make cheaper devices, cheaper drugs. And so Deloitte came out with an interesting paper about 4 years ago, basically looking at some of the top 10 innovations. And this is in that slide in front of you. And the premise is kind of interesting because there's, some really simple, kind of innovations when you think about like social media, for example, or biosensors. Anyone with an Apple Watch, it's tracking your heart rate, et cetera. But there's some other more advanced ones that are really going to change the healthcare landscape. Think artificial intelligence. Think 3D printed devices, which create cheaper tools, cheaper devices as well. Virtual reality is being used to come up with new vaccines. Immunotherapy, coming up with new, better ways of treating cancer. So there's a lot of different types of innovation in healthcare. It's an important sector. It's an important segment. Not only is it going to transform our lives, but it provides for an interesting investing space as well.
It certainly does. And let's take a look at that. We'll review the Nasdaq US Healthcare Innovators Index, the methodology behind it, Ben, and then also walk us through the top 10 constituents.
Right. So when we think about the Nasdaq US Healthcare Innovators Index, it is designed to track and provide exposure to the U.S. companies that are in early stage of innovation, right? So these are the companies that are, kind of at the leading cutting edge of, creating new drugs, new devices, new processes in the healthcare space. Some of those that I just mentioned and looked at in the previous slide. So the process that it employs to, identify these securities is basically kind of twofold. One, we essentially, take the U.S., stock benchmark, which is essentially kind of the Nasdaq US benchmark, and we screen for healthcare companies. And then we do a liquidity and size screen where we basically eliminate all the largest healthcare names. So we're going to be focusing on those smaller to mid-sized companies, and we also eliminate any of those illiquid names. And then the next step is essentially screening these companies, these smaller size healthcare companies, and looking at their earnings patterns. And what we're essentially looking for is kind of inconsistent earnings. We want to see companies that are actively investing in R&D and in some of those early stages of developing the next new innovative kind of healthcare product or drug. So you're really kind of pulling out an interesting list that is different than what you might find in some of the more traditional thematic indexes, more the traditional cap-weighted healthcare indexes. And then finally, we do kind of that size screen, so you get those smaller names, and essentially we're going to be weighting that universe by their market cap. So you're essentially going to have between 150 to 200 names weighted by market cap. You know, the index is rebalanced on a semi-annual basis. So if you look at the top 10 holdings, you know, some of these names, you know, some might be familiar, some might not, but they could be that next household name. The largest weighting goes to Moderna right now, and that was a company that was in the headlines just the other day. You know, they have the largest weighting in the index. They're in the headlines because, you know, one of their the initial trials for one of their COVID-19 vaccines looks to be promising. Acadia Pharmaceuticals, you know, that's a company that is developing, you know, drugs for dementia patients, and Exact Sciences, you know, molecular diagnosing, looking at early stage cancers. They're known for their, you know, colon cancer product. I think another company that is kind of interesting is Teladoc, right, which is this whole new sphere of telemedicine, you know, something that has grown exponentially because of, you know, COVID-19, the work from home. You know, people are afraid to, let's say, go visit a doctor. Use telemedicine. We're able to, you know, kind of interact with your doctor or nurse using, you know, services like Zoom. So, you know, that's been an interesting and growing space. So, you know, if we look at the top 10 holdings, it's not just kind of biotechnology companies. It's a diverse universe of innovative healthcare companies.
All right, Ben, we got another minute to go here. Let's review the performance.
Yeah, so when you look at performance, kind of when you're analyzing this index, the question is, you know, is it working? How is it performing against the market benchmark? And if you look at, you know, the past year, there have been periods where the index, you know, underperformed, let's say, the U.S. Healthcare benchmark from Nasdaq, but really since kind of the end of last year, it's been outperforming. You can see, you know, over the past 12 months, you know, looking at returns, is about 41% versus 18% for the healthcare benchmark. So we are seeing divergence against its benchmark. That's because of the exposure to some of these innovative companies, which tend to be smaller to mid-size. So we are seeing some outperformance here right now. And just given the way that we're seeing, you know, kind of spending increase, we're seeing the, you know, amount of R&D increasing the space as well. PwC produced a white paper a couple years ago saying that healthcare R&D spending is going to surpass technology this year. So, you know, all these different kind of characteristics and trends are really shaping up for an important way of, you know, tracking the space, and that's, you know, U.S. healthcare innovators. There's an ETF that tracks this. It's, you know, run by Principal. It's the, you know, U.S. Healthcare Innovators ETF, BTEC is the symbol. So that's one way of accessing, you know, this particular index.
That's good to know. There is so much overlapping here between healthcare and technology, certainly an index to keep track of. Ben, thanks so much for joining us on Trade Talks.
Thank you.
And thanks for joining me. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.